Dr. Meg Meeker. I'm staggered. 19 million American kids. And you have sex ed in school. You see, hear about condoms and everything, and you're saying it's not getting through. Why isn't it getting through?
Well, I think the kids are getting messages from everywhere. Let's face it, Bill, our kids are living in a culture that is selling them sex everywhere they turn. Big corporations are using sex to sell jeans and shampoo. Hollywood is coming at them. They're getting sexual messages everywhere they turn. And, to simply go into a classroom and tell a kid to use a condom just doesn't work.
Well, wait a minute now. What do you mean it doesn't work? If I go in and I'm the sex ed teacher, or whatever they call it these days, and I say, look, you don't use this condom, you can get all of these terrible diseases, all right? You can die if you get AIDS, all right? There's a whole bunch of stuff that can happen to you. You mean a 14, 13-year-old kid's not going to digest that?
They digest it, but you're talking to a 13 or 14-year-old kid, and one thing we do know is that the best medical studies we have available on condoms are showing, and the NIH has come out and said this, that we have insufficient evidence that condoms are going to reduce the risk of any diseases other than HIV.
See, I don't believe that. I mean, I just don't believe it. I think if you use that kind of protection, you protect yourself 70–80%. I mean, it's not 100%, but if you don't use it, you're playing Russian roulette. But kids are sophisticated enough at age 13 or 14 to know about all kinds of sexual techniques.
That's right.
All right? They picked up all the jargon. They picked up all the ways to seduce and all of that. They're not innocent anymore. You're telling me that they can't put that together, that if they're going to have sex, they better protect themselves? They can't put it together?
Well, first of all, kids using condoms aren't protected. Their risk is reduced of getting an STD.
Okay,
so we need to really say that. But all I can tell you is that the best medical data that we have across the country is saying that condoms aren't working well enough for our kids. In order for a condom to work,
but that's the only choice.
No,
so
it's not the only choice. No, it's not the only choice. Parents need to understand what the medical evidence is and how risky sex is for kids. Kids needs to know that.
Doctor, hold it.
They don't know that.
With all due respect. Any parent that's responsible knows there's a huge risk in having sex, particularly when children engage in it. If they don't know that, they're irresponsible parents. But the only choice you have two choices. You can either not have sex, and I believe in preaching that abstinent message, but you got to give them a reason not to have it, but I believe in that. But if they are going to have it, then you have to say you got to try to protect yourself, and the only way to do it is by a barrier, like a condom. So that's it. You got two choices.
You got two choices.
You got to break it down for these kids. Don't do it. And a lot of kids aren't going to respond to that for rebellion reasons, psychological reasons, and other reasons. But I think a lot of this has to do with intoxication. I think a lot of these kids get stoned and they get drunk. They don't know what they're doing, and that's what happens. Am I wrong?
Right. No, you're not wrong. But the truth is that parents and good teachers can communicate to kids that they don't have to be having sex. Look, Bill, our backs are against the wall right now. Condoms are not delivering for our kids.
All right.
Our backs are against the wall, and we have to teach our kids that sex is not for them.
I agree. I told kids in my classroom that to devalue themselves by letting someone have their way with you, all right, particularly if you're a girl, was going to cheapen you, coarsen you, and it was going to be all over the school, and you were going to be branded a slut. That's what I told them. 60 to 70% of those kids responded to that message. The rest didn't. Now, the rest are going to get the STDs if they're not taught about how to protect them. It's as simple as that.
But the best protection is to tell kids to wait. An earlier kid starts having sex. They need to get it.
30%, but they're not gonna, and you can't force them.
No, but Bill, parents don't understand that we have an epidemic on our hands, and teachers don't know there's an epidemic, and teachers are being given misinformation about condoms. And they need to have the good information.
Doctor, look, I could give your book to every child in this country, and 30% of those kids, number one, are going to reject the book out of hand because they want to have sex. And that's what I'm talking about.
That's not true. That's not true.
No, you think you can reach everybody?
No, but it's not 30%. It's more than, since 1990, the sexual activity rate of kids has been dropping off because kids are wising up.
Okay. Doctor, very interesting book. Every parent should get it, and we appreciate it. We'll be right back with the most controversial story.